For 16 years, hospitals across New Jersey and Pennsylvania unknowingly employed one of the most prolific serial killers in modern American history, a man whose job was to save lives. Yet he quietly ended them with a calmness that still chills investigators to this day. This is the story of Charles Edmund Cullen, the nurse who moved through hospitals like a ghost, leaving behind unexplained deaths, grieving families, and medical mysteries that went unsolved for years. A man whose crimes exposed deep flaws in America's healthcare system, loopholes that allowed him to kill again and again without anyone stopping him. Tonight we walk through Cullen's life, his motives, the hospitals that overlooked warning signs, and the investigation that finally ended his silent reign of terror. Charles Edmund Cullen was born on February 22, 1960, in West Orange, New Jersey. He was the youngest of 8 children, and from the beginning his life was shaped by loss, instability, and a profound sense of isolation. His father died before Charles could walk. His mother worked long, exhausting shifts to support the family. Cullen later said he never felt truly connected to anyone, even as a child. At age 7, he attempted suicide for the first time. It wouldn't be his last. By 1977, tragedy struck again when his mother was killed in a car accident. Cullen, only 17, was devastated. He dropped out of high school and enlisted in the U.S. Navy, hoping the rigid structure would bring direction to his life. Instead, things got worse. He was relentlessly bullied and never fit in. He attempted suicide multiple times while stationed on a submarine. Eventually, the Navy decided he was mentally unfit for service and discharged him. Cullen returned to New Jersey lost and aimless until he discovered nursing. In 1984, he enrolled in nursing school. Although socially awkward, he was intelligent and dedicated. Teachers described him as quiet, withdrawn, and overly serious. But he passed his exams and graduated in 1986, ready to begin a career in which he would be trusted with the most vulnerable people: the sick, the elderly, the desperate. None of them knew what was coming. Cullen's first job was at St. Barnabas Medical Center in Livingston, New Jersey. To coworkers, he seemed odd but competent, the kind of nurse who kept to himself but worked efficiently. The first suspicious death linked to Cullen occurred in 1988, when he administered a lethal dose of medication to a judge recovering from a routine surgery. Soon after, hospital staff noticed unexplained spikes of insulin in IV bags. Patients who were not diabetic and had no reason to receive insulin suddenly crashed. Even more disturbing, the contamination didn't always target specific individuals. Sometimes insulin or other drugs appeared in random IV bags, meaning anyone who received them could die. This wasn't mercy, this was playing with fate. The hospital grew suspicious of Cullen, but they couldn't catch him in the act. Afraid of lawsuits and bad publicity, they asked him to resign quietly. He did, walking away with a clean employment record. And because hospitals rarely shared internal concerns with each other, Cullen was free to start again somewhere new. Around this time, Cullen married and had 2 daughters. But at home, he was volatile. His marriage deteriorated rapidly, fueled by jealousy, emotional instability, and erratic behavior. His wife eventually filed for divorce in 1993, describing him as unpredictable and increasingly dangerous. She claimed he abused family pets, poured chemicals into drinks, and made disturbing comments about death. Still, nothing stopped him from finding work as a nurse. Nothing connected his personal instability to the rising number of mysterious hospital deaths. At Warren Hospital, Cullen's behavior escalated. Elderly female patients repeatedly reported that a strange male nurse entered their rooms at night. They claimed he injected them with something or adjusted their IVs without explanation. The next morning, those patients were dead. In one case, an elderly woman told her family and hospital staff about the nighttime injection. Her claims were brushed off as confusion or dementia. She died hours later. It was the same disturbing pattern. Patients stable one night, gone the next morning. Signs of medication manipulation. Strange entries in drug logs. Once again, administration grew suspicious. And once again, they let Cullen resign. He walked away untouched, leaving behind a trail of unexplained deaths that would later be confirmed as poisonings. Over the next decade, Charles Cullen worked in more than 9 hospitals across 2 states. Each hospital noticed the same things: unexplained medication withdrawals, deaths that didn't fit medical expectations, patients crashing during Cullen's shifts, red flags everywhere. But no report followed him to the next job. At some facilities, Cullen was asked to take polygraph tests. He refused. At others, he was caught entering medication rooms at odd hours. In one case, he was found sitting in a dark room, watching IV bags drip as if waiting for something to happen. Still, he continued landing new jobs. Hospitals didn't want lawsuits. They didn't want scandal. They didn't want to admit one of their nurses was killing people. This silence would cost countless lives. Patients who were recovering suddenly died during his shifts. Young, otherwise healthy individuals suffered cardiac arrest without explanation. Some patients had been doing well enough to expect discharge within a day, until a lethal dose of digoxin or insulin changed everything. By 2002, St. Luke's administrators confronted Cullen multiple times about drug access irregularities. They discovered he had been looking up medications he wasn't T-assigned to use and repeatedly accessing supply rooms when he wasn't T-scheduled to be on duty. Instead of firing him or reporting him to authorities, they allowed him to resign. It was the 9th time a hospital quietly ushered him out the door. Cullen's final job was at Somerset Medical Center in New Jersey. Within months, a cluster of sudden deaths alarmed staff. A dedicated pharmacist named Phyllis Hamilton noticed Cullen repeatedly withdrawing medications that were not ordered for his patients, including dangerous drugs like digoxin, epinephrine, and insulin. Her reports were ignored at first, but the deaths continued. One of the most suspicious cases involved a priest admitted for a mild condition. He was stable, expected to recover. But one evening his heart stopped without warning. Toxicology reports later revealed lethal medication levels in his system. Another victim, a cancer patient who was also stable, died suddenly after Cullen handled her IV. By late 2003, hospital administrators finally reached out to the New Jersey Poison Control Center. Experts immediately recognized a pattern of murder. Police began monitoring Cullen, gathering logs, interviewing staff, and reviewing medication records. When they confronted him with the evidence, he confessed quickly. But the number he gave stunned investigators. Charles Cullen admitted to killing around 40 patients, but then he hinted that the real number might be closer to 400. Investigators believe he murdered between 100 and 400 people, making him one of the most prolific serial killers in recorded history. When asked why he did it, Cullen claimed he wanted to end suffering. But many of his victims weren't terminally ill. Some were young, some were recovering, some were hours away from going home. His explanation didn't match the reality of his victims. The truth behind his motives remains murky, contradictory, and disturbing. In 2006, Charles Cullen was sentenced to 11 consecutive life sentences, ensuring he will never be released. He remains imprisoned today. His case triggered major reforms. Hospitals are now required to report suspicious employee behavior. Tracking systems for medication handling became far more advanced. Walk-away resignations, where dangerous staff quietly leave without record, became harder to hide. But for many families, change arrived far too late. Charles Cullen's story is one of the darkest chapters in American healthcare history. It exposed cracks in a system built on trust, cracks wide enough for a serial killer to pass through repeatedly for more than a decade. He used the tools meant to save lives as his weapons. He exploited vulnerability, trust, and institutional fear. He blended into the very environment meant to protect people. To this day, the exact number of his victims is unknown. Some families will never receive closure. Some deaths will never be connected to him. And chillingly, his case sparked a question experts still debate. Was Charles Cullen a one-of-a-kind predator? Or is the healthcare system designed in a way that makes it possible for similar killers to slip through the cracks? Charles Edmund Cullen's story forces us to confront a haunting reality. The people we trust with our lives can sometimes be the most dangerous. He wasn't a shadowy figure lurking in dark alleys. He wasn't a stranger hiding behind a mask. He was a nurse, a guardian of life, who became its greatest threat. His crimes remind us that systems, no matter how advanced, are only as strong as their willingness to confront uncomfortable truths. So now the question is yours. How could so many hospitals let this continue for so long? And do you think institutions today are truly prepared to stop someone like Cullen if it ever happens again? Let me know what you think.